3 weeks ago, Margaret walked into my office convinced she had early onset dementia. She was 68 years old, forgetting names, struggling to find words, experiencing what she called mental cloudiness that terrified her and her family. Her primary care physician had already ordered imaging. Her daughter was researching memory care facilities. But I asked Margaret one question that changed everything. "What did you drink yesterday?" She looked confused. "Water? I think. Maybe 2 glasses?" Within 24 hours of following a specific hydration protocol, Margaret's dementia symptoms disappeared completely. She wasn't losing her mind, she was losing water. And according to a landmark 2023 study from UCLA Medical Center, this mistake is happening to millions of seniors across America right now. Mild dehydration causes false elevations in critical kidney function markers by an average of 20%, leading doctors to diagnose conditions that don't actually exist. The blood work shows disease. The brain fog mimics dementia. But the real culprit? Something so simple it sounds almost offensive. You're not drinking enough water. And I'm going to show you exactly how this biological illusion happens and how to reverse it in 24 hours. The biological fiction of dehydration. Let me explain what's happening inside your body right now if you're even mildly dehydrated. Your blood is approximately 55% plasma, which is mostly water. When you don't drink enough, that plasma volume shrinks. Your blood becomes concentrated. Imagine taking a glass of orange juice and letting half the water evaporate. What's left? A thick, syrupy concentrate. That's what happens to your blood. And when your blood is concentrated, laboratory tests reveal higher levels of sodium, potassium, blood urea nitrogen, BUN, and creatinine. These are the exact markers doctors use to diagnose kidney disease, electrolyte imbalances, even prediabetes. But here's the critical distinction. These aren't real elevations. They're measurement artifacts. It's like weighing yourself with rocks in your pockets and thinking you've gained 20 pounds overnight. Now, here's where it gets truly dangerous for your brain. Your brain produces metabolic waste every single second. Proteins, cellular debris, oxidized molecules. In a healthy, hydrated state, your bloodstream acts as a delivery and waste removal system, flushing these toxins through what scientists call the glymphatic system, essentially your brain's garbage disposal. But when your blood is concentrated and sluggish, this system fails. Metabolic waste accumulates. Neurons fire inefficiently. Your brain literally slows down. The result? Memory lapses, word-finding difficulty, mental fog, confusion. Every single symptom that looks to you, to your family, even to your doctor, like early dementia. But it's not brain decay. The 24-hour Brain Clear Protocol. Now I'm going to give you the exact 5-step protocol I use with my own patients before any neurological assessment or blood work. This isn't about drinking more water randomly. This is about strategic cellular hydration that actually reaches your brain. Follow these steps in order, starting 24 hours before you need peak cognitive clarity or before any medical appointment. Step 5. The pale yellow indicator. Your urine color is your internal hydration GPS. You want pale yellow like lemonade, not clear like water, and definitely not dark amber like apple juice. Clear urine means you're overhydrating and flushing out critical minerals. Dark urine means cellular dehydration. Pale yellow means your kidneys are filtering efficiently and your cells are properly saturated. Check every time you use the bathroom for the next 24 hours. Step 4. The diuretic curfew. Starting right now. No excessive caffeine. No alcohol. I'm not saying zero, I'm saying excessive. If you normally drink 4 cups of coffee, cut it to 1 or 2. If you have wine every evening, skip it for 24 hours. Why? Because caffeine and alcohol are diuretics. They don't just fail to hydrate you, they actively dehydrate you by increasing urine production. You're essentially pouring water into a bucket with holes. For the next 24 hours, Think of your body as a hydration container you're trying to fill, not drain. Step 3, the slow sip rule. Here's where most people fail. They chug a bottle of water and think they're hydrated. Your cells can't absorb water that fast. It goes straight to your bladder and out. The protocol: in the 2 hours before you need peak brain function or before a medical test, drink 16 to 24 ounces of water. But sip it slowly over those 2 hours. Set a timer if you need to, 4 ounces every 30 minutes. This allows your intestinal cells to actually absorb the water, transport it into your bloodstream, and deliver it to your brain tissue. Hydration isn't about volume, it's about absorption rate. Step 2, the mineral anchor. This one surprises people, but it's critical. Pure water, especially filtered or bottled water, lacks the minerals your cells need to create what's called an osmotic gradient. Without that gradient, water doesn't move efficiently into your cells. It just sits in your bloodstream and gets filtered out. The fix: add a tiny pinch, tiny, about 1/8 teaspoon of unrefined sea salt or Himalayan pink salt to your first glass of water in the morning. This provides sodium, magnesium, potassium, the exact minerals that help water move through cell membranes and support your brain's electrical signaling. Think of salt as the key that unlocks your cells so water can enter. Step 1, the 24-hour reset checklist. Finally, avoid intense exercise for 24 hours before any important cognitive task or blood test. I know this sounds counterintuitive. Isn't exercise supposed to be good for you? It is, but intense exercise causes temporary dehydration, elevates stress hormones like cortisol, and creates muscle breakdown products that can skew blood work. If you're trying to get an accurate snapshot of your baseline health, not your post-workout recovery state, you need to let your body settle. Stick to light walking, gentle stretching. Focus on consistent hydration rather than metabolic stress. This is how you tell the real story of your health, not a distorted version created by preparation mistakes. The closing and call to action. Here's what I need you to understand. When you walk into a doctor's office, when you get blood work done, when you feel that brain fog creeping in, you're getting a snapshot of your body at that exact moment. And if the preparation is wrong, if you're dehydrated, overcaffeinated, or metabolically stressed, that snapshot is a distorted version of who you actually are. Margaret, the woman I told you about at the beginning, wasn't developing dementia. She was drinking 1 glass of water a day and 3 cups of coffee. Her brain was starving for hydration, and her blood work reflected that drought. 24 hours of proper hydration, that's all it took. So I want you to try this protocol. Start today, and then I want you to come back and tell me, have you ever had a health scare that turned out to be just dehydration? Drop your age and your story in the comments below. Let's build a community of people who understand that sometimes the most powerful medicine isn't a prescription. It's a glass of water. And if you want to keep your brain sharp, agile, and 10 years younger than your chronological age, watch our next video on the 5 morning movements that neurologists use to maintain cognitive reserve well into their 80s and 90s. Your brain deserves better than a drought. Give it the hydration it's been begging for. I'm Dr. Martinez. Stay sharp, stay hydrated, stay healthy.